a we thing.
It's a we thing.
Welcome back to the Community Health Worker Podcast. I am Anna Huff Davis.
I am Naomi Cottoms.
And we bring you greetings. And we're excited, very excited this morning to have with us a colleague, a friend, someone who has been very much an advocate for community health workers, Dr. Kate Stewart. Dr. Stewart is a professor in the Faye W. Bozeman College of Public Health at the University of Arkansas for Medical Sciences. She has studied the effectiveness of community health worker interventions for more than 30 years, translating what she's learned in rural Bangladesh to address health disparities in our home state of Arkansas. She has played a founding role in supporting community health workers through development of Arkansas's state association and voluntary certification for community health workers. Welcome, Dr. Stewart.
Thank you so much. I'm so happy to be here. It's great to be with you this morning.
This morning, we have the privilege of sharing with you some of our experiences with Dr. Stewart, as she has served as one of our notorious and famous non-traditional community health workers. First, we're going to listen to Ms. Cottoms, who's going to share with you her experiences, and then we're going to have some comments by Dr. Stewart, and I will also have some brief comments about my experiences with Dr. Stewart as a community health worker. Ms. Cottoms?
So I want the world to know that I was living my life, minding my own business, and started to cough and coughed for a couple of months, and the cough progressed and went to the doctor. And on February the 8th of 2022, I was diagnosed with stage 4 lung cancer, no cure. I was even told to go home and get my affairs in order. But even before I could see a physician, even before I could get the diagnosis, Dr. Stewart was by my side. Dr. Stewart came and had conversations with a few other people about my cough and my experience, and that my primary care doctor here in Helena had seen some spots on a scan and that I needed to get an appointment someplace else. And she worked diligently to help me get that appointment, along with a co-worker, Dr. Joseph Sue. And they were able to get me in. They were able to get me moving quickly and learned my condition. And of course, the treatment began. Dr. Stewart has been a friend through this. She's been a community health worker, even though that's not her official role. But she's walked with me through each appointment. She's used her professional training, which just happens to be that of a medical doctor, non-practicing, but medical doctor, to understand the information that was shared about my condition and those actions that I would need to take after learning about the condition. I was in a state of shock. I was totally dismayed and simply not even capable of comprehending what they were saying to me. All I heard was death, death, death. And so I couldn't hear treatment. I couldn't hear anything that might make the process better. And so thanks to Dr. Stewart, information was received. She sat with my sister through every meeting, every visit, every test, to make sure that information was accurate, understood, and that I would follow the plan. She not only helped me by being by my side at the doctor's offices, but she got busy and when I was in need of having caregivers in my home and couldn't afford to pay people to come in. She scheduled friends and family to do a week at a time to come and actually care for me. And people came, people gave of their own lives to come. But it was a lot due to, and people did care about me, but it was a lot due to Dr. Stewart's making the request and Dr. Stewart coordinating the schedule. And so people came and my care was provided. Dr. Stewart continues to be with me as I walk through this part of my life with visits and making sure that medication is provided and making sure that I'm protecting myself from COVID and just doing those things that community health workers would do, even to trying to identify health resources, making sure we met a social worker and making sure that we applied for things that we needed, like parking stickers for the car, making sure that we applied for new hair that we would need due to treatment, just making sure that whatever cancer resources were available, making sure that we had a list of all the resources that existed and looking for additional resources so that I could have them. Her role was so much like that of a community health worker. It's been unreal. And while I know that it came out of love for me, concern for me, a friend helping a friend, every characteristic of a community health worker that we can name: being knowledgeable, being compassionate, caring, a willingness to work and serve. All of those things are who make up the personality of Dr. Kate Stewart. And so I am just excited and grateful to have known her, to have her friendship. But it's amazing that she could do this. And sometimes, even while caring for me, she was caring for others. I recall a friend who was walking through the death of her husband, and she was equally by her side. And so this woman is a special community health worker, even without community health worker training, even without officially wearing the title. And so I am honored. That's my story. And I want to now ask Dr. Stewart, what motivates you? What gets you started?
Oh, wow. I'm getting all emotional hearing that story again, because it was such a hard journey you went through, Ms. Cottoms. But I'm so grateful that you are healthy today, and that all of the treatment and perseverance on your part has resulted in you being more healthy today than you were last year. So you said it, I love you. You are my friend and my sister, and that is a big part of it. And also just feeling like, based on my own experience of having cancer, as you know, I had breast cancer in 2006. Just knowing from my own experience how terrifying that can be, and how hard it can be to make all those decisions about what you should do, what kind of treatment you should have, who you should see, how do you access all those things, and how important it was for me to have my brother and my husband with me when I was going through that. I just wanted to make sure that that I was there to help you navigate. So that navigation aspect of it seemed like something that I could easily do because of my background and my position at at UAMS, and it just seems like the right thing to do to help connect people to the services and resources that they need when they're struggling with a horrible illness like you have been. But I'll also say that I have been inspired by the two of you amazing women that watching you guys. I've known you guys for over 20 years. And is it 25 years? So, we've been through a lot together, and I've seen the incredible work that you have done running the Connector program, the connectors being community health workers, and just being inspired by how much of a difference you and your programs, both of you, have made in the lives of the people that you and your community health workers have made. It's been very inspiring for me. So those are some of the things that I would say just have made a big difference for me.
So, Ms. Davis mentioned that you had done some original work in Bangladesh. Could you share a little bit about how you got into that and how it related to being a community health worker or related to community health work, period?
Sure. So I grew up in Arkansas, but I left home to do international work, and ended up living in Bangladesh for 3 years and working in a program there called the Maternal Child Health and Family Planning Program. And it was basically a community health worker program. There were Bangladeshi women who were hired and trained to serve the women in their communities and their villages. And that was really an incredible experience to watch how they were able to actually, from their service, to reduce infant mortality and child mortality by helping those women to better care for their children. And so when I moved home and started thinking about how we could improve the health of especially in rural parts of our state and people who don't have good access to care, I just felt like there were a lot of opportunities to apply some of those same concepts of community health workers in Arkansas.
Okay. Well, thank you, Dr. Stewart. And Ms. Davis, we'll hear your story.
I'm somewhat speechless this morning, this afternoon, or whatever time it may be where you are. Kate has also been, as she said before, we've known each other for a long time, and the three of us, we have definitely shared some experiences, and I have had some bouts with cancer as well. And so, as Naomi stated, she has been more than you would ever expect someone to be, especially someone who's not a member of your family. She's been closer to me than some members of my family. I had an experience with breast cancer, and as Naomi said, from day one, she was there and sort of guided me through that process, my husband and I, because we think we're health literate, but when it comes to things like this, you don't know what you don't know. And so she took notes for us. She recorded sessions with the doctors for us. And I'm sure Naomi had these same experiences.
Yes.
And so she truly is a community health worker in every sense of the word. As Naomi said, she may not wear the title, but she is an example of what a community health worker should be. And so I had surgery. I had a bilateral mastectomy, and she was there for all of that. She was there with my family during the surgery. She was there when I was going out of the room. I saw her face. When I came back, I saw her. This woman is just phenomenal. And I just want to give her the accolades while she can hear them and know how much we also love her. And those are the relationships that you have with community health workers. They're like a member of your family. If there's truly a relationship there. And we just want her to know that we appreciate what she's done because she didn't have to do that. But as community health workers, that's what we do. We do the things that don't have to be done and that other folks won't do or don't think about doing. And so her profession has afforded her that knowledge and expertise that we lack as lay people. And whatever your experiences may be, you may not be an MD or have some letters behind your name, but whatever your life experiences are, you can bring those to the table as a community health worker. And that's one of the uniquenesses of a community health worker. So I would like to ask her, how does it feel when you're with a family and you're not a family member, but you need to say some things sometimes that family members may not say and may step back from saying because they may hurt the feelings of the person who may be going through whatever they're going through? How does it feel when you're put in that? And I guess that will fall somewhat back on your medical experiences as an MD, but share with us what does it feel like when you're going through or you're serving in that role, and family members may not know who you are, but we make you known and you make yourself known when you speak. How does it feel to you? What types of feelings are going through your mind and what are your thoughts? Does that question make sense?
Well, first of all, I would say that I feel incredibly honored that the two of you allowed me to be a part of your journey with your disease, because I feel like it is a privilege to be able to walk with someone and accompany them when they're going through that, because that takes a lot of trust from you to allow someone to be there. And so first of all, I just want to say I felt very honored and privileged that I was able to be there with you. And I guess I'm trying to think of an example. I do feel like sometimes we need to have conversations that are difficult conversations and not shy away from those, but to do it in a way that is, I think it's very tricky. You don't want to go too far, but you also don't want to have the fact that you haven't had a hard conversation keep someone from getting what they need.
Mm-hmm.
Yeah.
Mm-hmm. Mm-hmm. Mm-hmm.
So I think that's the other part of it. Like you're saying, when you know that there's a need there, whether it's just, we have certain silences, things we just don't talk about, right?
Mm-hmm. Mm-hmm. Yeah. Yeah.
And
You mentioned the word trust, and that's so pivotal when we talk about community health workers. And both of us, and I think I can speak for Naomi as well. We have that kind of trusting relationship with you because we know who you are. I guess what I want to say is that in those relationships, community health worker relationships, you sometimes meet people that you're meeting for the first time. And we had something totally different. We had been together for years. And so trust is pivotal.
Yeah. I also want to add that one of the things she did with my family was work to build a relationship with them, people that she hadn't met who were an intricate part. She established a relationship with them, came on and shared stories about our closeness, and began to um, build that trust with them as well, so that when she spoke, people were willing to hear.
Mhm.
Can I also say that, did you have something else, Dan? Can I also say that, I don't know if you remember this, Anna and Naomi, I don't know if I told you this, but, Anna was the one who told me that you, had seen the Dr. Bailey and he had told you about your cancer. And I was so upset. And she was the one who told you to contact me. I don't know if you remember that. I'm sure you don't, but I asked her, and Anna, do you remember this conversation that we had when you were so upset and you called me and you told me, because we had been talking about the fact that Naomi was not getting better. She'd had
Mhm.
that cough for a long time, and you were supposed to go. And we knew that you were having some tests and things, and you weren't talking to me about the details. And so Anna was
I do.
you were the gatekeeper
Yeah.
for me, because you made Naomi trust me. I know we've been friends for a long time, but that was hard for you. I know. And I think the same thing with your family members. You guys were the reason they trusted me, because you felt like they could. And so I think for community health workers, knowing who to build that relationship with
Mhm.
helps them to have, an opening to be trusted by others in the picture that need to be
Mhm.
informed and brought into the loop of things.
Mhm. I'm glad you mentioned that, Kate, because I had forgotten about that. But as you were saying, I was so upset and didn't know what to do. But I knew somebody who possibly knew what to do. And so that was one of the reasons why I called you. And based on my experiences, it's all about experiences. Based on my experiences with you, I knew that if you didn't know what to do, you would find somebody who knew what to do. And so yeah, I did. I remember. I remember very vividly now. And so, as community health workers, and that's why it's so important that we know where resources are, not so much who can provide the services, but who can even serve as a resource. That is so important. And we stress that a lot in our training. Naomi does such a good job with that when we talk about community health workers knowing where and who the resources are, because that's the key a lot of times. Where can I find this uh, resource that I may need at this particular point in time, or who can serve as that resource?
Or the connection. Remember, Dr. Marbuino was the first person we thought of. Well, he wasn't the one who provided the care, but he got us into the system, right? For
Right,
me. Yeah.
right. In closing, we want to highlight the positive messages here and just let you know that if you've received a discouraging diagnosis, don't steer away from seeking uh, treatment or seeking resources that may be available. Science has come so far over the last 5 to 10 years in developing new drugs and better treatments every day. And speaking from my own personal experiences, there are treatments now that weren't available 5 to 10 years ago when I was initially diagnosed. So just remember that there is hope. Um, Naomi?
And I'd like to just add that Anna and I both continue to have life. that on July 12th, my body was sent through several scans and came out showing no cancer cells. So we're happy to be alive. We're really grateful to God, grateful to our community health worker, our personal community health worker, Dr. Kate Stewart, our family and friends. And we're just excited about continuing to live, being able to continue to do our work. We want to thank Dr. Catherine Stewart for being with us today, for being a part of this podcast. We hope that we shared some thoughts that are relative to you, that may be beneficial to you. And we hope you will continue to join us. It's a wee thing.
It's a wee thing.
It's a wee thing.
It's a wee thing.
It's a wee thing.